Thank you for joining us today here on To Your Health on GBMC's Facebook Live page. I'm your host, John Lazarou. Today we're talking about cancer survivorship, and it's a big part of the life after treatment and what happens once you've beaten cancer. So joining us today to talk about this important subject matter is Dr. Robert Donegan, who's the medical oncologist with the Sandra Malcolm Berman Cancer Institute at Greater Baltimore Medical Center. I can't believe I got that out.
It's a mouthful.
It is. Dr. Donegan, thank you so much, and welcome to our show. So let's kick it off. We talked about the word cancer survivorship, okay? And from what I read, nowadays there's about 15 million cancer survivors here in the United States. And according to research that was done in one of the journals, the Cancer Journal for Clinicians, they said that number by 2026 will grow to 20 million. And one of the things that the study found was because of targeted treatments and medicine that's available nowadays to help cancer survivors live longer. So let's start off. What is a cancer survivor? What is the exact term of cancer survivor or cancer survivorship?
Well, the simplest definition is it's somebody living today who has been at some point diagnosed with cancer. That's the simplest definition. But to expand upon that, it really can be people in a variety of different phases of cancer. It could be somebody who's been diagnosed with an early stage cancer, who has tackled the cancer. There's no signs of the cancer, but they live perhaps with the risk of cancer recurring. It could be somebody who has been in that situation whose cancer has recurred, and now they're living with active, ongoing cancer. Or it could be somebody who, at the time of diagnosis, is already diagnosed with advanced cancer, and so they may be beyond cure, but they are still living with the cancer and fighting it.
So and I know you've probably seen this, how many years have you been a medical oncologist?
21 years.
21
now.
years, wow.
Oh, I feel old.
So in your 21 years, working and dealing with patients, what are some of the emotional and maybe the physical side effects of surviving cancer?
Well, the obvious emotional concern is the fear of recurrence in somebody who does not have signs of the cancer presently. And that is, an ongoing awareness that people have to live with and tackle. It's oftentimes most intense soon after a diagnosis or soon after completing therapy. But we have to work very much with them along the way to try to help quell those fears and deal with those fears and validate those fears, because it's they're not imagining this, that fear is there. The physical side effects are myriad. There can be physical side effects from the cancer itself. There can be side effects from the active treatment, be it surgery, radiation therapy, chemotherapy, other medications. And there can be lingering side effects or symptoms long after the treatments have stopped that one has to contend with. There may be a medication, for example, that might slightly increase the risk of heart problems down the road. And so that's something that we have to be aware of, decades down the road after a cancer struggle, for example.
Now, you talked about the emotional and the physical side effects of surviving cancer. Is that, and you mentioned it earlier, phases of cancer survivorship. Is there various phases of cancer survivorship? And if so, is the physical and the emotional side effects part of those phases? Well,
of course. I in a simplistic way, I guess we think of three phases. We think of the phase, sort of the acute phase of the new discovery, the emotional, having to come to terms with now being part of a group one never wanted to be a part of, and that is a cancer survivor. There is the next phase, which is the active treatment phase, which can involve, again, surgery, maybe radiation therapy, maybe chemotherapy, maybe. It all depends upon the individual cancer and scenario. And then there's the aftercare phase, which is, again, where we find the emotion of worry about recurrence and the emotion that one has to deal with regards to lasting side effects and toxicities.
Joining us today here on To Your Health is Dr. Robert Donegan, who is a medical oncologist with the Sandra and Malcolm Berman Cancer Institute at Greater Baltimore Medical Center. I encourage our audience members and those watching us on Facebook to please send in your questions. And I mention this every month, if there's an issue with privacy, please send us a private message and we'll see if we can address that question with Dr. Donegan. Actually, Dr. Donegan, before we started our show today, we did have some write-in questions. So I have one from George and Joanne who sent in. It's almost a similar question, and the question is as such: can a patient diagnosed with breast cancer ever be declared cured, or once you have cancer, even if there is no evidence of recurrence after 5 years or so, don't you have, quote unquote, cancer for the rest of your life?
It's a great question and a great dilemma, as to whether one can comfortably consider themselves cured. I think the experience of cancer is always with you, even if it is fated to never recur. And so I think if somebody is living with a particular cancer where there is a long risk of recurrence, then even if there's a small chance of recurrence, as long as there is a chance of recurrence, many of my patients don't necessarily consider themselves cured because of living with that risk. But there are other cancers where we know that if there is going to be a recurrence, for example, it may universally happen within 5 years. And so once they pass that 5-year mark, then they are beyond the risk of recurrence. And so arguably that patient indeed is cured. And so, we have those conversations with our patients. A lot of times it really comes down to what the patient wants to visualize themselves as being. I've got some patients who live with risk of recurrence, but in their mind they're cured. That's how they approach the day. That's how they wake up the next morning, and that's how they go about their day. And that's what works best for them, is to consider themselves cured. Even though there may be risk, that's how they get through their day. Others, even with the most minute of risk, they'll never call themselves cured, even though they may have a 99% chance of being cured. So I think it's not so much what I think, it's really what the individual patient perceives it to be.
In the intro, I talked about cancer survivorship plan, which according to the study, that's one of the reasons why we see more and more people surviving cancer. So can you talk to us about what goes into a cancer survivorship plan? And I don't want to use those same words because it could be used in other ways. It may have another name by it. But can you tell us, when you deal with your patients, about creating a cancer survivorship plan, what goes into it and how do you approach that?
So the idea behind a cancer survivorship plan is to have a plan or a paper or an online source of information for the patient that usually it's created towards the end of treatment, and it very descriptively describes what therapies they had, if they had surgery, what the surgery was, what the results of the surgery was, radiation therapy, what type of radiation therapy, how long it was, what the dose was, medications, specifics about the medications, also describes what the stage might be, what the unique type of cancer might be. It's just really chock full of information. So that's kind of the information side of it, and it's helpful if one's moving out of state to another place and they need to show up at another physician's office and say, here's what I got. That's really helpful with transitions. But it also includes information with regards to what the optimal follow-up should be, who should be doing the follow-up. Should it be one physician or 3 or 5, what the frequency of follow-up should be, and how that changes over the years. Inherent it is usually a sense of what the prognosis might be, what the risk is going to be for recurrence, what studies or tests should be done or not be done as part of the follow-up, and then access to a lot of the issues that might be unique to that patient with regards to emotional health, with regards to bone health, with regards to long-term side effect monitoring that's specific to what therapies they had. So it's a whole bunch of things all in one place that a patient can refer back to, and not be bewildered. It's funny, not funny. It's interesting to see how often a patient may not really know what their stage was, or even years down the road. So this is a nice way for them to have a reference point that can be very informative to them.
Now, it's safe to say that when someone realizes that they've been diagnosed with cancer, as hard it is on the patient, it's also hard on the family members and the loved ones of that patient. So my question to you is, what is some advice that you might be able to provide to family members during this vulnerable time of their loved one?
Yeah, I'm glad you asked that, because these are families and communities that are going through a diagnosis, not just the patient. And I think the support of loved ones, of family members, is so crucial to how somebody gets through a cancer experience. And I think as caregivers, we have to be sure that we take care of ourselves. So I think anything that people can do, obviously, for their own wellness, is going to allow them to be a better presence in the life of their loved one who's going through the cancer experience. I think being informed, coming to visits, being knowledgeable oneself, so that you can be a good sounding board for your loved one. Obviously, having very good communication with your loved one, that's a given in any relationship, I imagine. And there are resources available for caregivers, for family members. There are online communities that are available to talk to people that are sort of in your own situation, because sometimes you feel like you're on an island, your friends just don't understand, but somebody who's been through a similar experience will. And there are support groups that are out there for family members. There's a wonderful place here in town called Hopewell, which is outside of the Beltway in Baltimore County, that is a very nurturing and holistic center that provides all kinds of outreach programs, including support groups for family members. So I think it really is important to make sure that the caregivers are being taken care of too.
Joining us today is Dr. Robert Donegan, medical oncologist with the Sandra and Malcolm Berman Cancer Institute at GBMC. I encourage our attendance members and those watching us on Facebook Live to please send in your questions. And again, if there's any privacy issues, you can always private message us as well. Dr. Donegan, let's talk about cancer survivors and family members. If I'm not mistaken, next month in June, we hold the Cancer Survivorship event that's coming up, correct?
Yes.
All right.
Yes.
And I think we've been doing that for how many years now?
At least 20 years. Something like that. Yes, something like that. Yeah. I think it's been going on nationally. The initiative began almost 30 years ago, and we got involved relatively soon after it started. So it's a great event.
I know you've attended the event in the past, and I wasn't going to go out on a limb and say you're probably going to attend this year's event as well.
Yep.
So let me ask you a question. From your patients that you've talked to and that you've seen at this event, what kind of a response do you get for them participating in this event and seeing all those people that were, not just you, but everyone involved in their treatment, in their battle against cancer at GBMC?
Yeah, I mean, it's the feedback's just wonderful. I mean, and we hear it time and time again. In so many different ways. I think, first of all, it's nice for them to go to a nice, comfortable environment, away from the white coats and the ivy poles, and be around all of these people that have been part of their support team. The nurses, the dietitians, the social workers, the medical assistants, and so on and so on. And everybody's there. Not everybody, but most of the people are there. And it's just a real nice coming together of patients and their families with the support team that's been there from GBMC. I also think there's a really good energy in the room because it's cancer survivors together with people who have a like understanding. And I think there's a real energy and coming together when people who have a common understanding can co-support each other. You'll hear a lot of times where people can't necessarily talk to their friends because their friends haven't walked the walk and they don't quite understand. But in this room, there are people that have all shared a common experience, and I think that's just a real nurturing environment. So we get that feedback every year.
You talk about how the event helps the cancer survivors and also, but how does it help, for example, maybe some of the family members and also the caregivers that helped these patients seeking treatment for their cancer? How does it help I don't want to say the other half, the other 2/3 of the equation?
Well, I think there's a similar theme there because it's caregivers meeting caregivers too. So it's that sense of community of people coming together that can share a common experience that they collectively understand. So I think there's that component to it. And also we make a point to recognize the caregivers too. It's the day is, center stage, of course, are the cancer survivors, but we realize that the supporting band are the caregivers, and they too are embraced and acknowledged that day too.
Actually, we have a question from our audience.
Yes, we do. We also have a few comments from our viewers who are watching on Facebook. We have Ari Elman, who says Dr. Donegan is the best. And we have Helen Colwell Anderson, who says she's a survivor of 25 years, and she was treated at GBMC by Dr. Gary Cohen. But now for our question from our audience member here today. It's about ampulla cancer. It says, what is the survivor time if you've had chemo and radiation, and is this cancer a reoccurrence?
So that's a real rare cancer. Ampulla is a part of the intestine where the pancreas drains its enzymes into the intestine. So it's a real rare cancer that we just don't see many of at all. Like many cancers, if it's detected early and can be surgically removed, then one's prognosis is going to be more favorable than if it's already spread to other places. And so I think that's probably the most important defining difference is, was it surgically removed or not? If it's already in other places, then the scope of therapy changes. No, we're not necessarily expecting that we're going to be able to cure it, unfortunately, but hopefully the therapy can keep it at bay for a while so that one can live better and longer with the disease. I know that's kind of generic in the answer, but I think it really comes down to that specific detail of whether it was confined or not.
We have actually a question that came in before our program from Amy. How does the increased oral chemo approach affect your adherence? Going from infusion center to kitchen table, what about eating or having a healthier lifestyle?
Yeah, so there's a few questions there, and great questions. Oral therapy has become much more commonly used in oncology. Back in the day, 20 years ago, almost all therapies were given through intravenous routes, and so people had to come into the infusion center and get treated. And now, gosh, I'd guess that probably 45% of our therapies are oral therapies that are being taken at home, and which is good and bad. The good is that it's certainly more convenient, less time in the infusion center. So I'd rather be in my own home than in the infusion center if I was a patient. The downside is sometimes cost and coverage and expense, because coverage for oral medicines isn't always as good as it is for IV medicines, although through Dr. Solano's efforts and others here in Maryland, we've been able to change that in Annapolis so that coverage is really pretty good for oral therapies compared to what it was several years ago. Compliance, we can't monitor it as well because we're taking the word of the patient that they're taking it, but patients are usually pretty candid if they've stopped a medicine. So I'm not sure that compliance is really as much an issue. In fact, it may be better because, again, they're taking it at home and not having to come in. So from a convenience standpoint, that may improve compliance. What was the second part of the question?
The second part of the question was, going from infusion center to kitchen table, what about eating or having a healthier lifestyle?
Yeah, I mean, underscore, exclamation point, bold type. I just can't emphasize that enough. In all aspects of cancer care, beginning with prevention. I mean, we know that if we could get our society as a whole to exercise more, eat more healthy, not smoke, our cancer centers wouldn't be empty, but they sure wouldn't be as full, because a lot of the, not all, but a lot of the cancers are related to lifestyle. So that would help. And certainly while going through therapy, the better you can take care of oneself, the better you're going to do in tolerating therapy and maybe even surviving your disease. We know with breast cancer, for example, that vigorous physical activity is associated with a lower risk for breast cancer recurrence, and to a lesser degree, healthy diet and optimizing body weight. So those are messages that I drive home to my patients every time I see them. I think it's really important. I saw a patient this morning who told me that she's gone to the gym, and she took our last visit to Heart, and she's at the gym 4 days a week, and it's just really great to know that just talking about it can make a difference. I just can't emphasize enough the importance of healthy lifestyle choices when it comes to survivorship.
Joining us today here at To Your Health is Dr. Robert Donegan, medical oncologist with the Sandra and Malcolm Berman Cancer Institute at GBMC. We've got about 5 more minutes left in our program, but we do have a question from our audience. Mindy?
Yes, actually from me. Hi, John.
Hello, Mary Beth. How are you?
So I have heard, and I'm asking this of the doctor because I think that he'd be the person to ask. I have long heard that Maryland has a very high cancer rate. Is this still true, and are there theories as to why that is?
So I think it's true, although you have to step back and look at the whole picture. I mean, everything's kind of clustered at the top. There are a few outliers, some of the states in the South that really kind of fall out much lower. But there's a lot of, actually, the states in the South are actually at the top. But there's a lot of clustering. So I think sometimes that gets exaggerated, that we're much, much worse than the other surrounding states, but I don't think it's quite that much of a difference. Part of it may be that we if some of it can be a good problem, and that is if we have better access to care, we may have a slightly longer lifespan than other states, and the longer people live, the more likely they are to experience a cancer, for example. Better access to health care can also lead to a greater discovery. If we're doing a better job at doing screening mammograms and colonoscopies, for example, we may actually see more cancer, not that it's necessarily any more prevalent, it's just that we discover it more. Some of it also may reflect, especially in this area, we have industrial complexes like Sparrows Point. If you go to the eastern part of the county, we definitely see a disproportionate higher incidence of lung cancer, for example, esophageal cancer. These are cancers that are associated with carcinogen exposures, maybe from Sparrows Point, maybe because of a higher incidence of smoking in those areas. So there's a lot of variables that I think play into it. We're definitely clustered towards the top when it comes to the country, but it's not dramatically higher than a lot of the surrounding states.
Dr. Donegan, we have another question. Actually, it was from two people that had the similar question, from Rachel Ann and Diane. Do you think adding holistic medicine is helpful when battling cancer?
So the answer is yes. I think patients really have ownership over their own cancer experience, and I think whatever tools are going to enhance their life, their viability, their sense of coping, their sense of empowerment, I think there is a lot of value to that. And so most patients who go through a cancer experience find that they use some form of holistic approach in addition to sort of the conventional cancer approaches provided at the cancer center. And that can range from a whole variety of things. It could be going to Whole Foods and getting organic vegetables, or it could be doing Reiki therapy or massage or meditation or acupuncture. Certainly there's a whole wide span of supplements and vitamins that patients will take to empower themselves. We have to, one cautionary note is that it's important to discuss that with one's treating team, because some of those may have some impact negatively upon the therapies, and we have to always keep that in mind as a bit of an asterisk. But I think it's important for patients to feel empowered, and they can be very proactive on their own outside of the clinic.
We have time for one more question. The question is, let's see, I just had it. Maybe I just lost it. Anyway, doesn't matter. So Dr. Robert Donegan, medical oncologist with Greater Baltimore Medical Center's Sandra and Malcolm Berman Cancer Institute. Dr. Donegan, first I want to thank you for joining us here today. I also want to thank you for your service to our country, because you did your time as an Air Force pilot.
Wow.
So I want to thank you for that as well.
Not as a pilot, but that's okay.
Well,
I did sit in the cockpit of Air Force One. That's my claim to fame.
So technically he was, by absentia. Anyway, since I'm saying thank yous, I also want to thank our audience members that joined us, not just today, but over the last several months. And also those of you at home or at work watching us on Facebook, I want to say thank you very much, because really without you guys, we couldn't do what we do up here, and I really appreciate that. I also want to thank, I know we have one nurse in our audience, but I want to thank all the nurses that I've come across. Thank you. And I thank them, not just in my professional career, which has spanned many years working in a hospital-based setting, but also my personal life, those that took care of my family members and my loved ones. But I want to especially thank two members of my family that are nurses, my cousin Penny and my sister-in-law Angel, who are nurses who work tirelessly to help their patients, regardless of what those patients are dealing with. So thank you, Penny, and thank you, Angel. Thank you, Dr. Donegan. Thank you, everybody. We won't be here in June. I'm going on vacation, so is Mary Beth and Don. But we're not vacationing together, so I don't want the rumor mill to start up. We're all going our separate ways. We're all going our separate ways, but we will be back together July 18th. That will be the next day for To Your Health here at 12:30. Again, thank you all. Happy and safe summer 2018. Dr. Donegan,
Hey.
to you and to all of you out there, cheers to your health.